So when we look at going through, if you want to kind of follow through on your sheet, that should hopefully help us or help you through that. So we're going to give you some sort of dispatch. Right now, the scenario for this first time through doesn't really matter. We're going to give you a pretty basic medical scenario. We'll start with that, and then we'll do our trauma. So we'll say that you're dispatched for a 64-year-old male patient having chest pain. And so as soon as we give you that scenario, we're going to ask if you have any questions. You can say no, and then you can go ahead and start. So when we start, we want you to come in. So we have our scene is safe. I don't see any scene hazards. We have our BSI on. We're going to identify the mechanism of injury or nature of illness. Nature of illness in this particular case is chest pain. Number of patients, I have one patient. We're going to consider additional resources. Additional resources for a cardiac would be ALS, so advanced life support, and then we're going to consider C-spine. Because it's a medical call, we probably aren't going to need to take C-spine right at this time. Okay, as I approach my patient, I'm going to start my primary assessment. So we're going to grab our general impression. I see an approximately 64-year-old male patient clutching his chest or rubbing his chest. He appears to have to be in some pain. So my general impression, we move on to level of consciousness. How do we determine that? Sir, my name is Nathan. I'm with NWTC Ambulance. What seems to be the problem?
I got some chest pain right here. I'm having some trouble breathing.
Okay, so the patient told me he's having chest pain and difficulty breathing, right? So when I look at my level of consciousness, my patient's alert, right? We then identify our chief complaint. He's telling me that his chief complaint is chest pain and some shortness of breath. Once we identify those, we can start our ABCs. So airway, he has a patent airway. How do I know that? He's talking to me. So I'm not going to shove in an adjunct at this point. I'm going to assess his breathing, and we'll say that we can see that he does have some shortness of breath with labored breathing. And so my treatment, we're going to go ahead and have our partner set up oxygen, and we're going to put oxygen on. We can start off at non-rebreather, 15 liters is fine at this point. Okay, and then we're going to check circulation. Sir, do you mind if I check your pulse?
Sure, go ahead.
Okay, so we're going to check for a pulse, looking at that rate, rhythm, and quality. So he does have a pulse. We'll say that it's rapid because it's a cardiac problem. Skin color, temperature, and condition. Right, we'll say that he's pale, cool, and clammy. And then I don't see any other hemorrhaging or any bleeding. And so we're going to go ahead and put your arm down. We're going to determine our patient priority. It's cardiac, so they're a high priority patient. So that's going to allow us to start our secondary exam. I'm going to actually sit down next to the patient here so that I'm at eye level and not like, sir, you suck. Wait. So, as we start our secondary assessment, we're going to get our history. So I'm going to start with my OPQRSTI clarify. So as far as onset, when the pain started, was it a sudden onset or a gradual?
It was sudden.
Okay, so it just kind of came and...
Yep, all of a sudden.
Okay. P for provocation. So does anything make the pain worse?
Got a little bit better when I sat down, but not much.
Okay. Quality, can you describe the pain for me?
It actually kind of feels like somebody's sitting on me.
Okay. R is for radiate. Does the pain go anywhere other than in your chest?
A little bit up into my left shoulder and into my neck and jaw.
Okay. Severity on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you could imagine. How would you rate your pain?
8 or 9.
All right, so that's pretty bad.
It's bad.
All right. Has it been an 8 or 9 the whole time, or?
Yeah.
Okay. And then our time. How long ago did this pain start?
About half hour, 45 minutes.
Okay. So right now it's about 2:30. So you're saying it started about 2 o'clock?
Yeah, 2 o'clock.
Okay. Has the pain been constant since 2 o'clock?
Constant.
Okay. And then have you interventions? Have you tried anything prior to me getting here?
The lady on 911 told me to take some aspirin.
And you took the aspirin?
Yep, 4 baby aspirin.
Perfect. All right, so we've gotten our OPQRSTI. I've asked some clarifying questions, so we're good with that section. So we're going to move on to our sample history. So signs and symptoms. Patient told me that he's having chest pain, and I saw the respiratory distress. We have him on oxygen for that. Do you have any allergies?
No.
Okay, are you taking any medications?
Yes.
Which medications do you have?
I take metoprolol for my blood pressure, and lisinopril, and something for my cholesterol.
Okay. What kind of past medical history do you have?
I have a couple stents from a previous heart attack.
All right. How long ago was that heart attack?
About 4 or 5 years ago.
Okay. When's the last time you had something to eat or drink?
Lunch at about noon.
Okay. And then what were you doing when the chest pain started?
Shoveling.
All right. Out there doing some physical activity.
Shoveling snow.
All right. So we got our OPQRSTI, we got our sample history, so now we're gonna go ahead and grab, we're gonna do a physical exam. So for my physical exam for this patient, and we'll get into this, but it's chest pain, so I'm gonna do a look for reproducible pain. I'm just gonna push on your ribs here. I want you to tell me if I can recreate that pain that you're having.
No,
No, it feels like it's coming from inside.
from inside.
All right, I'm gonna go ahead and quick listen to your lung sounds. Okay, I need you to take a nice deep breath, as deep as is comfortable for me. Does that cause any additional pain? Okay, one more. Okay, we're listening. 2 more spots here, one more deep breath. All right, so lung sounds are clear, so we have our physical exam done, so now we're gonna go ahead and get our vital signs. Okay, we're just gonna put that on your finger. Okay, we're gonna check for a pulse rate here, and once you start to check it, we'll grab you a pulse rate. So I'm assessing for pulse and respiration, so we'll say that his pulse rate is 112, respirations are 22. I'm just going to shine a light in your eyes, check your pupil reaction here. Okay, pupils are equal and reactive to light, and we're going to assess blood pressure. Where's your blood pressure go? SpO2 is 95. And we'll check for blood pressure. We're going to have you kind of place it on, and as soon as you start pumping up, we'll give you the blood pressure. So we'll say his blood pressure is 148 over 100. Your metoprolol isn't working very well right now, sir. Did you take it this morning?
Yes, I did.
Are you sure about that?
Yes.
All right, so once we got our, so we now have our history, right? We have our physical exam, we have our vital signs. Based on all that information, I'm gonna say that my patient is having chest pain, suspected cardiac in nature as my field impression. We're gonna go ahead and give you a treatment plan. Once again, at this point, you can just say, we're gonna treat the chest pain. Once we move on and we teach you stuff, then it would be a matter of, our patient's on oxygen for his shortness of breath. We're going to administer 324 milligrams of aspirin, have him chew that. We're going to administer, he didn't have nitro, so we can't administer that. So we go through and give him our medications, aspirin, and that would be our treatment plan. Once we're done with that, we're going to go ahead and consider a detailed physical exam in the ambulance on the way to the hospital, and then we'll start our reassessment. For my reassessment, the 4 things we're going to reassess: primary assessment, looking at LLC and ABCs; secondary assessment, looking at physical exam and my history of present illness. We're going to reassess vital signs. It's a cardiac patient, so we're going to do every 5 minutes, and then we're going to reassess interventions that we've done, and then you can say that you're done. Now, I know I don't think anybody timed it. You can stop that too.